I always kind of had that need to want to help people, and I know that's what everybody says when they go into healthcare, but that's kind of what initiated it for me. And working as a nurse, I could tell that I was good at that, and I was ready to take on more responsibility and do more with my advanced degree. I want people to not be afraid to come to the gynecologist, and I want you to feel not judged and not nervous to tell me anything that you need to tell me, because they are very personal appointments and exams. So I just want to be that person for them. When you start with your first OB visit, we usually, if you're new to our practice, we kind of learn about you, like your medical history and prior pregnancy history, and we get you that first pregnancy test ordered. And then once that pregnancy is confirmed, you will come back and see one of us nurse practitioners through the practice, and we do your nice new OB visit after you have that first dating ultrasound, so where you first get to see the baby on the screen. We just try to get a really good handle on what the plan will be for your pregnancy, so that way you know exactly what things are going to look like as you progress through your trimesters. Usually for the labor and delivery side of things, once you get into your third trimester, we have a packet that we typically give patients, and it's called the third trimester packet. There's a preference sheet for you to kind of put things down on what your preferences are for birth, pain management, people that you want in the room to prepare you for that time when you're going to have the baby. I do see all patients of those ages. I'll see really, young girls, probably like 13 or older if we're talking about periods or birth control. There's so much other than sexual activity in gynecology. There's vaginal infections and UTIs and all the things, and then menopause as well. So I do some hormone replacement therapy with women. Usually if you have a very complex medical history, sometimes we'll then kind of get you set up with one of our more menopause specialists. But I kind of do a little bit of everything through the years. The most rewarding part of my job is probably giving people a better experience when they come to the gynecologist. I pride myself on making you feel comfortable in my room and feeling like you can tell me anything.